afternoon to the jury and everyone present here. I am Dr. Mayukh Hazra. I completed my MBBS from Medical College, Kolkata, and currently first year resident at Department of Dermatology, Medical College, Kolkata. So today my topic of discussion is the complications of type 1 diabetes. So in the introduction I would like to say that diabetes is recognized as an emerging epidemic, and India is said to be the center and possibly could become the diabetic capital of the world also in the recent future. Though type 2 diabetes is more common and type 1 constitute only 10% of the cases, but due to the younger age of onset and the more duration of the disease, there is more complications and morbidity associated with type 1 diabetes. So classification of complication we can do into the acute and chronic, and in chronic complications we can go according to the involvement, the microvascular and the macrovascular. So we can see the incidence also, which is more common. So we can see the neuropathy is most common. Now in acute complication, if we focus in the second picture only, it becomes clear that in decay and hyperglycemic hyperosmolar states, so if there is relative deficiency of insulin hormone, then it leads to increased glycolysis and gluconeogenesis, which leads to hyperglycemia and it leads to osmotic drive, and it causes profound dehydration. In case of diabetic ketoacidosis, there is absolute deficiency of insulin hormone that leads to lipolysis, and it causes increased ketone body production and acidemia. So in the chronic complications, if we go into the mechanism of the complications, the first theory deals with the advanced glycosylation end products, and the second theory deals with the increased sorbitol pathway that leads to increased sorbitol intracellularly, that leads to increased intracellular osmolality, redox potential, and increased generation of reactive oxygen species that causes cellular dysfunction. So if we go into depth of the microvascular complications, first comes the diabetic retinopathy. It could be classified into non-proliferative and proliferative. In proliferative, we can also see vitreous hemorrhage, and cystoid macular edema can also be seen. So the screening should be started after 5 years of diagnosis of type 1 diabetes. In diabetic nephropathy, it is the leading cause of end-stage renal disease in India. In diabetic neuropathy, it's seen in 50% of the patients of type 1 diabetes, and it responds well to vitamin B12 and tricyclic antidepressants like amitriptyline. Now coming into the macrovascular complications, so cardiovascular morbidity and mortality has shown to be markedly increased, and silent MI could also be seen. The cerebrovascular diseases have also been shown to increase, like transient ischemic attacks and cerebrovascular accident. In gastrointestinal system, it mainly leads to the gastroparesis, and in genitourinary system, it leads to cystopathy and sexual dysfunction. So in the lower extremity complication, diabetes mellitus is the leading cause of lower limb amputation in the United States. In infections are more common in diabetes due to the fact that it leads to abnormalities in the cell-mediated immunity and dysfunction in the phagocyte function. So in superficial infections, it could cause Candida albicans and Staphylococcus aureus (UTI). But in case of serious infection, also like invasive fungal infections like rhinocerebral mucormycosis. In dermatological manifestations, the classical lesions are the necrobiosis, lipidoica diabeticorum, acanthosis nigricans, and granuloma annulae. So this acanthosis nigricans patient was spotted in our OPD only. Now we forget about the psychological effects. So it's a long duration of illness, and it has the psychological morbidity also. In young, type 1 diabetes hampers the psychosocial development and degrades the school performance. and the incidence of depression is also 1.33 times higher than that of normal population. Now, in the prevention of complication, we should give proper education and support to the patient, and lifestyle modifications should be advised with proper glycemic control. Now, if we come to the recent advances, the regulatory T cells have been targeted against the islets of pancreas, then it has shown to be effective in animal models. A recent study of postmenopausal women with type 1 diabetes showed increased cardiovascular risk compared to the postmenopausal women who are non-diabetic. And there is potential cure to diabetic neuropathy also by the NSI 189 molecule, which has shown effects in the animal model. And incentives among adolescents can lead to adoption of healthy behavior. Now, in conclusion, I would like to say that complications of diabetes, type 1 diabetes, can affect multi-system of our body, not only body but also our mind, and it leads to significant mortality and morbidity, though there is ray of hope with the new advent of molecules that we can possibly cure the disease and prevent the complications. These are my references. I would like to thank MCSA for giving me the opportunity to present. So my time is over, but I would like to explain this image by saying thank you. That this is the flame of hope of Ontario, Canada, that signifies that diabetes means we can prevent the complications of diabetes and control the hyperglycemia, but the disease process is still burning. So let's pledge that we invent some molecule that can cure diabetes completely or prevent the complication. So let's pledge to stop the flame completely.
Thank you.